know you have a couple different techniques to performing a labiaplasty, and I feel like this has been a very commonly asked question, but what technique do you prefer?
I prefer the trim technique. So the two main techniques used are trim and wedge. And the trim is sort of following along the natural curvature of the labia. And that I think gives the nicest result and gives a nice symmetry. It removes in patients that have the the extra skin, it can sometimes be more pigmented, darker, or more corrugated, so more wrinkly. And so it takes all of that out and leaves them with the more ideal tissue behind. And I think it heals consistently and just very well with no evidence of an incision. The wedge procedure is like taking out kind of like a slice of pizza from the center and then closing it. And the plus side is that you're not operating on the edge of the labia, but that center piece is prone to breakdown if not done carefully. And there's some variability in the blood supply that you have to be cognizant of. At least you need to at least be aware of that when you're doing that procedure. And if there's a wound breakdown, it's kind of a pain because then you have like a hole basically in the labia. So I'm not as big of a fan of the wedge procedure. And I think it's a little harder to make things as small as possible, which is generally what my patients are requesting. Yeah.
And does any of that affect sensation?
No. So that gets back to the itching. Neither procedure will affect sensation. I think if there's any risk to sensation, it would be with related to that clitoral hood balancing surgery that I mentioned. But again, if that's done properly, which you're literally just taking the skin off, then we know the nerves travel deep to that area and are not affected. So everything heals just fine. And the two sensations that come back generally with healing are sharp shooting pains and itching. And for whatever reason with this procedure, itching is things are coming back and that there's not going to be any numbness or change in sensation because you're going to itch.
Yeah, I feel like lately it's been like a sensitive question to ask, and then nobody wants to ask it. And then I get an email and I'm like, will it affect the sensation during intercourse? And I'm like, we're all girls, you can ask.
Right. I know. Right. I feel like it's funny what people like are willing to ask and then what they aren't willing to ask and then ask you behind the scenes. And we do try to head all of that off and then bring it up. Yeah, it won't change sensation during intercourse. So in that way, I'm not going to guarantee it's going to enhance anything either, right? So that's a conversation you can have. And then the
with
other
your
common
partner, if you tell them.
right. They might not notice. The other question we get is if I'm on my period, either for the consultation or for the actual procedure, right? And we're like,
everyone starts it the day of their procedure. It's just the way it works. Patients are like, I'm not supposed to start for a week, but for some reason, everyone always starts it the day of their procedure.
Yeah. So if we had to work around people's periods, we would never get anything done. That's what we say. So it doesn't matter. You just need to let us know. So I don't think you're just suddenly spontaneously bleeding.
That did happen. She was like, oh,
yeah.
You're bleeding. She's like, oh, no, I'm just on my period.
That's right. Yes, that was my one post-op patient, like didn't mention it. I think she was like 2 weeks out, so I wasn't expecting any blood. And I had this look on my face and she's like, oh, I have my period. I'm like, oh, thank God. And then I think every time I saw her after that, she was on her period, no matter what. I think I saw her later for Botox and filler, and she's like, I just want you to know I'm having my period, even though you're not even looking there.
It's fine. Just want you
Happy to provide that service for you.
It's this office. Everyone cycles up.
Yeah.
Just the way it goes.
Yeah. We usually blame Megan.